Hi everyone, welcome to Imaging Study. Today we are going to see a case of incomplete abortion or retained products of conception. A young married female patient came with lower abdominal pain and pervaginal bleeding. She had given a history of amenorrhea for around 2 months and also history of taking abortifacient drug. Let's see what we have got on ultrasound. Here you can see the longitudinal section of the uterus showing irregular mixed echogenic substances at the uterine cavity, predominantly at the lower uterine segment. And on transverse section, you also can see this heterogeneous area quite well. This central heterogeneous area is the retained products. On color Doppler, you can't see any prominent vessels within this heterogeneous product, though the peripheral prominent vessels are seen. Overall, the uterus is bulky and the endometrium appears thickened. So this is a case of incomplete abortion. Here is the longitudinal and transverse section of the uterus showing the irregular mixed echogenic retained products of conception at the uterine cavity. So in summary, a bulky uterus with thickened endometrium is seen. Irregular mixed echogenic substances are noted within the uterine cavity, predominantly at the lower segment, indicating retained products of conception. Now the take-home message. In confusing cases, both longitudinal and transverse sections will help confirm retained products of conception. Thank you for watching this small video. See you on the next one. Have a nice day.